How can we make sure that the tests currently being used to diagnose COVID-19 are efficient and don't produce false negatives? In terms of epidemiological data, what's most relevant when fighting a pandemic? European scientists from the Joint Research Centre are attempting to answer these questions and tackle some of the other challenges facing the European Union. Scientists have developed what is known as reference material to make sure coronavirus tests don't wrongly give a negative result in someone that's infected. This reference material is based on molecular biology. Its main component is a synthetic, non-infectious part of the virus that has remained stable during mutation.
From an analytical point of view, this molecule behaves exactly like the genome of the coronavirus, but it's not infectious, as it's not a complete particle. This allows the molecule to be used for analyses and guarantees that during the analytical process, which is quite complex, everything goes smoothly.
This innovation not only gives labs and companies producing COVID-19 tests a guarantee that their kit is working, it also harmonises equipment across Europe. The idea is that if tests don't spot the reference material, they won't detect the real virus.
This positive test enables us to say for certain that everything is under control, that the test works properly. So if a patient gets a negative result, it will be because the virus isn't there and not because the test didn't work.
Since the very start of the pandemic, researchers have also been collecting a large amount of epidemiological, social, economic and environmental data. The goal is to help governments in Europe respond better to the virus by giving each country a picture of its own specific circumstances.
This information has, for instance, been used to understand the needs linked to medical equipment, respirators, masks, intensive care units, how many medical posts will be needed in the following weeks, etc. In reality, the problem of data has always been important throughout the pandemic and is even vital today. But it was important to follow the peak of the outbreak. Now it's also crucial to follow how it's evolving, where cases are falling, or to identify new cases. This is still one of the #1 priorities in the European Union.
After studying the spread of the virus and its potential impact during lockdown, scientists are now focusing on what they call exit scenarios in the post-confinement phase.
The cases are under control, but they may re-escalate. There may be a restart of cases. And our modeling and our scenario work is geared towards the possible ways that this could play out in the summer, balancing the tourist sector economically versus the public health risks.
Researchers say they're working closely with other institutions on these exit strategies, including the European Centre for Disease Prevention and Control in Sweden.